Hello, my name is emilystaley. I'm from Indiana State University. I'm in the RN to BSN program. This is for my community health nursing class, my health education project number 2. I'm going to be talking about the population at risk, coal miners. Learning objectives. Upon completion of this presentation, the viewer will be able to list 3 specific health risks coal miners endure, state why coal miners are an important population at risk, explain 3 ways nurses can implement creative strategies to decrease and change the risk miners face, identify 5 ways to reduce health risks against coal miners, and discuss high-quality, safe nursing care and emergency preparedness in regards to coal miners' safety. Please stop now to take the pretest to assess your prior knowledge about coal miners. The pretest can be accessed by clicking the link titled Pretest in the description of the YouTube video below. Why are coal miners an important population at risk? Miners are at risk for developing serious lung disease. One is called pneumoconiasis. This is due to the miner's exposure to the fine particles of dust that can be inhaled into their lung tissue. Miners are at risk for lung cancer, including a higher risk of death from lung cancer. This population has been at risk for decades. You would think that over the decades, prevalence of these health risks will have gone down, but we have not seen that. There have actually been the same, if not more, injuries and death related to coal miners. And that's from an article on the CDC that's listed in my reference. Ultimately, there still is a lot of work to be done to help this part, and there are people out there trying to do that. Let's talk about a couple of the health risks that are associated with the coal mining. Like we said before, there's increased risk of that lung disease, lung cancer, and death. There's also explosives during the detonation process to release rock from inside the mining caves that release toxic gases. That can cause acute respiratory illness as well. Detonation of these blasts can injure or even kill miners by the rocks that are thrown from the blast. The consistent bending the miners endure when in and out of caves and mining puts them at an increased risk for scoliosis. How can we reduce these health risks that coal miners face? The Respiratory Health Division of the NIOSH has created programs to help assess coal miners' possible health risks. They give miners access to chest x-rays every 5 years. They also track the coal miners' scoliosis or their spine shapes to reduce the risk of scoliosis. They continue to research and find sources of the high respirable dust that causes the lung disease. They provide miners with all appropriate safety gear and continue to provide them with new gear once previous gear had been worn down. They develop better systems and regulations to continue to provide miners safety from the rock being thrown during detonation blasts. So this is just one program, association that's helping them, but as we're learning, community nurses can be a huge part of this to help with these health risks they endure. So now I want to talk about the ways that nurses can implement creative strategies to decrease and change the risks that coal miners face. A couple of my ideas are this. Nurses in leadership can gather volunteer teams of nurses, medical assistants, nursing assistants, and other personnel and set up free clinics around the community at different times and days for miners to include things like head-to-toe assessments, vital checks, listening to lungs. We could measure their spine curvatures with the scoliosis tool, provide resource material, help them schedule chest x-rays with their local hospitals and clinics, and discuss why that's so important to do that at a minimum of every 5 years. They should do it yearly. We can put together local community donation centers in which the community can donate gently used gear, new gear, or even just donate money to purchase new gear for the miners in their area. One of the big issues with miners having these accidents and being prone to exposure is using the same respiratory gear that they've had for years and years and years, and eventually it's just not good enough to do its job. We can also have local nurses research and track the precedence of black lung disease, and other health issues in the entire community associated with local mines. Remembering that communities centered around coal mining sites are exposed to increased risks of things such as neoplasms, circulatory disease, respiratory disease, metabolic diseases, eye and skin disease, perinatal disease, and even chromosomal abnormalities. This is a serious problem. On top of those ways that community nurses can help with local things such as the clinics and the donation centers, how can community nurses implement high quality, safe nursing care and emergency preparedness to this population at risk? My thoughts are nurses can reach out to local mining companies and offer to review their safety protocols and offer evidence-based suggestions on how to create safer working habits. We could offer free local safety classes to miners, their families, and the community in general to educate them on the health risks of mining and populations near mining and how to prevent those health issues. We can work with local fire departments to implement a cohesive emergency response team with the community nurses so that they are alerted during a coal mining emergency and can assist miners in the fire department if needed on site. Together, we can reduce these health risks associated with coal miners and their communities. And by doing that, I think we could really make an impact on communities with these mining sites around. Thank you for watching this presentation. Please take the post-test to gauge how much you've learned about this population at risk. Click the link titled Post-Test in the description below.